How to remember cranial nerve muscles easily. Imagine trying to recall a list of friends at a party. It's easier when you group them by what they do or where they are. The same idea works for cranial nerve muscles. These nerves are like messengers that control muscles in your head and neck. They come from the brain and brainstem, each with a special job. Some control eye movements, others help you chew, smile, or swallow. Knowing which nerve controls which muscle can seem tricky at first, but there are simple tricks to make it stick. Start by learning the main nerves that control eye muscles. The third cranial nerve, called the oculomotor nerve, handles most eye muscles. Think of it as the boss for moving your eyelids and eye muscles. The fourth nerve, called the trochlear nerve, manages the superior oblique muscle, which helps your eye look down and to the side. The sixth nerve, known as the abducens nerve, controls the lateral rectus muscle, which moves your eye outward. Visualize these three as a team working together to keep your eyes moving smoothly in different directions. Next, focus on muscles involved in chewing. The mandibular branch of the fifth cranial nerve, called the trigeminal nerve, is responsible for muscles like the temporalis and masseter. These muscles help you bite and chew food. Remember that the trigeminal nerve is like the power source for your jaw muscles. For facial expressions, the seventh cranial nerve, called the facial nerve, is the key player. It controls muscles like the orbicularis oculi and orbicularis aries, which help you smile, frown, or blink. For swallowing and throat muscles, the ninth cranial nerve, called the glossopharyngeal nerve, controls the stylopharyngeus muscle. The 10th nerve, called the vagus nerve, manages most muscles in your throat and voice box. Think of the vagus as the conductor for your voice and swallowing muscles. The 11th nerve, called the accessory nerve, controls neck muscles like the sternocleidomastoid and trapezius, which help turn your head and lift your shoulders. Lastly, the 12th nerve, called the hypoglossal nerve, is the main nerve for tongue movements. To remember these nerves and muscles easily, use simple grouping. For example, group the eye muscles together and remember they are controlled by nerves 3, 4, and 6. Think of the trigeminal nerve as the power for your jaw muscles, and the facial nerve as the one that makes your face move. Visualize the pathways. Nerves 3, 4, and 6 pass through the superior orbital fissure to reach the eye muscles. The trigeminal nerve exits through the foramen ovale to reach the jaw muscles. The facial nerve leaves through the stylomastoid foramen to reach the face. Create a mnemonic to remember the nerve names in order. O to touch and feel very good velvet. Ah. This helps you recall the sequence of nerves. Then associate each nerve with its main muscle group. For example, think of nerve 3 as the boss of most muscles, nerve 4 as the supervisor of the superior oblique, and nerve 6 as the manager of the lateral rectus. For the jaw, remember the trigeminal nerve powers the muscles of mastication. For facial expressions, the facial nerve is the key. Finally, visualize the routes these nerves take inside your head. Remember that nerves 3, 4, and 6 go through the superior orbital fissure. The trigeminal nerve's mandibular branch exits through the foramen ovale. The facial nerve leaves via the stylomastoid foramen. Connecting these pathways with their muscles makes it easier to remember which nerve controls what. So, to keep it simple, learn the main nerves, group muscles by their function, use mnemonics, and picture their paths. This way, remembering the muscles each cranial nerve controls becomes less of a puzzle and more of a clear picture in your mind. Understanding this helps you see how your nervous system controls your head and neck muscles, which is key for both learning and clinical practice.